Hi my beauties, welcome to Derm Life. So today we're going to be talking about microneedling. And the reason why I want to talk about microneedling is because a lot of patients ask me about this. They've had it done, they have questions, they wonder why they don't have great results. I get a lot of DMs on microneedling daily, so I really wanted to discuss this topic and kind of go over the pros and cons and the truth about this procedure. So microneedling is used to treat fine lines and wrinkles, acne scars, pigmentation issues, texture issues, and it was originally created because fractionated lasers were having such great results that scientists wanted to come up with a device that was a little bit less elegant or a little bit less time consuming or a little bit less technology, but with the same equivalent results to a laser. So back in my fellowship, after doing my dermatology residency, I did an aesthetics procedural fellowship in dermatology, and microneedling had just came out. We were so excited. I even did a whole news segment on microneedling, and we were really excited about this new concept. And so when the devices first came out, we were testing them out on our patients. Our patients seemed happy. They had great results, 2, 3, 4 days later, but then they would have to come back a week later or a month later for additional treatments. And so then we started to say, well, maybe this isn't as good as a laser. So different companies came out with different tweaks to the microneedling devices, including radiofrequency, adding in PRP with the procedures, which stands for platelet-rich plasma, and other modifications to make it a little bit better, a little bit stronger. But we still weren't seeing these sustainable results that we see with lasers. So kind of getting into the physics and mechanics of the treatment, microneedling is when you poke thousands of tiny little holes with micropunctures with some type of device, either a medical grade device or even at-home treatments with a microneedling pen or a microneedling patch. And so we started to see that afterwards patients look really good, but because they probably had some transient swelling or inflammation. Whenever you traumatize the skin, fluid gets pulled into the area and can smooth over fine lines, wrinkles, shrink pores, help with acne scars. But then days later, when your skin starts to heal, it goes away. So then patients have to come back and have another treatment, and then that transient little inflammation happens and they look good, and then it goes away. So this is the problem that we're seeing with at-home microneedling devices, because the results are not sustainable. So I have no problem as a dermatologist with at-home treatments, but with non-sustaining results, you don't want to have to keep doing these treatments over and over again for a transient side effect that's going to make you look better. So also what happens is sometimes my patients will come in with post-inflammatory hyperpigmentation from microneedling devices. What that means is in darker skinned individuals, if they have any trauma to the skin, whether it's a curling iron burn or an oven burn, they get darker in that area. Well, microneedling device is essentially traumatization of the skin. And so when you poke these thousands of tiny little holes, there's increased blood flow to the skin that stimulates the melanocytes, which are the pigment producing cells in the skin, and then they get darker. So I had a patient the other day that came in and she was using an at-home microneedling device under the fine lines and wrinkles under her eyes, and she had these dark brown patches under her eyes from months and months of using this at-home microneedling device. So we had to reverse that pigmentation by using skincare products, lightening agents, and actually fractionated laser devices, YAG lasers, pico lasers, to try to reverse that pigmentation. And so I thought to myself, I need to get the knowledge out there and protect patients from buying the wrong products or using the wrong treatments or investing in different treatments that are not only going to not work or have sustainable results, but may have deleterious side effects that in the long run will harm you. So basically what a laser is it's a very elegant device. It's collimated light at a specific wavelength that's going to treat microthermal zones in the skin. Now when the laser beam is emitted, it heats up the skin and it also dissipates out that heat. It's called coagulation, and it stimulates your body's own regenerative processes to make collagen, to make elastin, to smooth out fine lines and wrinkles, to smooth out acne scars, and the results are sustainable. When patients come back 6 months later or 12 months later for maybe their second or third treatment, they still have the benefits of the initial laser treatment, which means a lot to me as a dermatologist. If you're having some transient improvement secondary to a side effect or swelling from the microneedling device, that's not sustainable, and in my opinion, it's not worth the time, money, and investment for patients to invest in a treatment that is just going to be temporary, more from the side effects of the procedure. So, and that's why, in my opinion, if patients are going to invest their hard-earned money, I would right now invest more in like a baby Fraxel. It doesn't have to be a big, laser procedure, but there's different tiers of lasers and different levels of aggression. So the lower tier lasers, which are, for example, Clear and Brilliant Permea or Clear and Brilliant Baby Fraxel or Fraxel facials, the downtime is minimal. There's maybe an hour of redness after the treatment. The cost is low. It's probably equivalent, or usually on a clinic by clinic basis, equivalent to a microneedling treatment, and the results are lasting. And so if you're going to invest your hard-earned money, I would invest it more in a lower tiered laser like a Clear and Brilliant instead of microneedling at this time. Now, that's not to say that microneedling is not going to improve fine lines, wrinkles, and acne scarring. It does, but again, it's temporary, more from the swelling that you get from the treatment. So, I mean, you can have somebody hit you in the face and have a transient edema or swelling that's going to make your acne scars look better, or you're going to have an improvement in your fine lines and wrinkles from the swelling that occurs, but that's not sustainable, and that's more of a side effect of the procedure or the traumatization of the skin than an actual true effect. So when lasers treat the skin in these microthermal zones, the heat that gets dissipated out is going to stimulate your body to make collagen, make elastin, and tighten up the skin. If you look at a wound that is a result from like a burn scars are flat, they're tight, they're smooth because there's a lot of collagen. What lasers do is it's basically inducing a controlled wound healing environment. So it's not creating a burn scar, but it's the same mechanics and physiology that makes that smooth skin, that tightens that skin, and it helps those fine lines and wrinkles by making collagen in a very low-key, very controlled, very elegant manner. So lasers, in my opinion, there's nothing that really can touch the elegance of a laser at this point. So that's not to say that microneedling in the future down the pipeline can make improvements in this technology and maybe have amazing results, maybe even better than the laser in the future. But for right now, I don't think that we're quite there yet. And whenever we go to our meetings among physicians, so world-renowned dermatologists, plastic surgeons, we all get together and we present our data. We present our anecdotal data, we present our randomized controlled studies, research, FDA-approved studies, and we try to compare a treatment to the baseline or gold standard, which is usually a laser. So microneedling head-to-head in studies with a laser isn't having the same long-lasting effects, and so it's hard for me as a dermatologist to recommend that at this time. Now, when you're talking about the lower cost treatments like a facial or a hydrofacial compared to a fully ablative laser, that's a lot of money, a lot of downtime, and it's more of an investment of your time and money. I think that when you're trying to consider what to spend your money on, I would spend it more on either chemical peels, Clear and Brilliant laser, facials and hydrofacials, things of that nature that are going to have a lasting effect. So this is just my opinion. I hope you find it useful. I hope it's helpful to you, and there will be more to come.